The pinworm. This one, for those of you who have children or plan on having children, this is one you're gonna have to watch out for. Okay? Transmission for Enterobus vermicularis, also known as the pinworm, is fecal oral, but not in the way that we've talked about in previous mini lectures for this chapter. What happens here is that the eggs get deposited around the perianal region. Remember, perianal is going to be around the anus, between the anus and the scrotum or the vagina. Okay? They get deposited there, and as they dry, they cause an itch, an irritation. Somebody scratches, okay? Then somebody touches something else. They've now transferred using their fingers the eggs from their perianal region to whatever it is they just touched. Or they rub their mouth or their nose and their mouth, their face. Or they touch food and ingest it that way. They ingest. So there's this auto-inoculation this way where their perianal region, their fingers, their mouth, and they just ingested eggs. Or they touch something that somebody else has touched that passed the eggs. They touch, then they touch their mouth, and they've just introduced the eggs to themselves. What happens is that we have the male and female worms in our large intestines. Person who has this infection, generally it's going to be a small child, but it can be adults. Adults with small children seem to be the ones who get hit adult-wise the most. Male and female in the patient's large intestine, especially around the rectum. Male and female worms do the deed. Child goes to sleep, and it's one of these things that while we're asleep, circadian rhythms allow for many of our muscles to relax. One of the muscles that relaxes somewhat, but not all the way, is the anal muscles. Well, this rhythm of sleeping, relaxing, triggers the female worm to exit out the anus and wiggle around there in the perianal region, depositing eggs. Once the eggs are deposited, the female worm will then wiggle its way back through the anus into the rectum. Later that day, the itching starts. Small children don't care, okay? There is no social proprieties. They have an itch, they're going to scratch it. They're going to scratch their butts. They're going to dig down in there and scratch around their anus. Then they're going to, not thinking about it, put their fingers in their mouth. Or they're going to touch a toy and then put the toy in their mouth. They're going to touch the toy, and then another child at the daycare is going to put it in their mouth. That's how they either auto-inoculate or transmit the eggs to somebody else. Parents of the small children like that, little kid scratches, touch something, mommy and daddy touched it, and then mommy and daddy touch their own mouths. There you go. Infections aren't fatal, okay? There are no fatal. It's mostly asymptomatic other than the itching. Problem from a parent standpoint is the way you diagnose. When the child goes to sleep, remember, female worm comes out while they're asleep. Well, the parents have to go in while the child is asleep and put a piece of Scotch tape over the anus. Pull it off gently so as not to wake the kid up, because nothing's worse than waking up a grouchy kid. And take that Scotch tape and then put it on a glass slide. The Scotch tape will pick up anything around the perianal region. worms, eggs. You put it on the, you've now trapped the worm, the eggs between the Scotch tape and a glass slide. You go, you give that back to the doctor. The next day, they'll send it off. A lab will look at it under a microscope, looking for worms, looking for eggs. The thing is, there are some anti-worm drugs that are quite mild. They're not very low levels of toxicity, negligible levels. So give that to the child. The thing is, if one child in a family is diagnosed positive for Enterobus vermicularis, they say to go ahead and treat the entire family because you don't know what that kid has touched, and other people are going to touch and then touch their mouths. So the entire family will be treated all at once.